Welcome to the Resilient Training Lab podcast.
What's up, everybody? Welcome to another episode of the Resilient Training Lab podcast. Today, we're joined by Mike Velasquez, who is not only one of our clients, but he's a physical therapist. And so we have a lot of conversations about training and the nuances behind both rehab and performance. And today, we're going to dive a little bit into his thoughts on training, rehab, and his experience going through PT school. So thanks for joining us, Mike.
Yeah, I'm excited to be on with you guys and honored that you guys asked me to be part of your show.
Absolutely. We're hoping you bring some valuable insight. So before we get into the specifics of your PT school, I know your journey there wasn't as straightforward as a lot of probably your peers. So what did you start with in undergrad?
So my undergrad was it was a little bit of a tumultuous journey because I've changed majors a few times. So I originally went to my undergrad. I started as a psychology major. This was before I had even like my freshman orientation on campus. And then for some reason, I really had this idea that I wanted to be a lawyer. So I really wanted to go to law school. I think I saw, a few good men in like a high school law class that I took. And I was like, all right, I'm going to be a lawyer. So I got in. When I was choosing classes, I had asked one of the people, is psychology a good major if I want to go to law school or whatever? They said, well, maybe you should be poli-sci. So I switched over when I was at orientation to be a political science major. So I started off as that for my freshman year. Quickly realized that I really didn't enjoy any of those classes that I was in. It was a lot of kind of gen ed courses, but the stuff I was reading, I just really wasn't enjoying it all. I ended up taking my spring semester of my freshman year, biology and chemistry, and I really enjoyed those, did well in those. So I ended up switching my major back to psychology, but then I also added biology to it. So I ended up going through that, ended up graduating in 2012 with a dual degree in biology and psychology, but I really didn't know what I wanted to do with that. I toyed around with the idea of, maybe going to pharmacy school or, trying to go to med school. But at that point, when I kind of toyed around with the idea, I felt like I was already behind the game there because, usually people are doing a lot of shadowing hours or doing a lot of extracurricular activities to really ramp up their resumes to get into those schools. So I kind of just went through school, finished up and just got those degrees. But again, I really didn't know what I wanted to do with it, once I graduated.
You hit two of the three, I guess, core values, right? Biopsychosocial model that we'll talk about later. You hit biology and psychology right there.
Yeah, honestly, when I first graduated, I was like, what am I going to do with a psychology degree? But it's come into, that whole psychological side of things has come into play a little bit more than I anticipated.
And then in your podcast, you had mentioned that you were selling insurance for a little while.
Yeah. So once I graduated, one of my family members has worked at the Hartford Insurance Group for a very long time. And she had just mentioned to me, you know what, you just got out of school. Why don't you just get a job, just start making some money and then you'll find out maybe you like that or you can just move into something else in the company. So I said, okay, I'll just do that. So got into selling auto and home insurance. Really didn't like that at all. I'm just really not a great salesperson in terms of, dealing stuff I guess I don't really care about or believe in. So I just really never felt fulfilled doing that. And I really discovered that I wasn't a desk person whatsoever. And I hated just being kind of in a cubicle for, 8 hours a day. And I really honestly dreaded going to work. Like I remember those drives just heading into work and just being absolutely miserable and knew I definitely didn't want to do that for the rest of my life.
Yeah, Hartford, Connecticut's the insurance capital of the world, and the Hartford is clinical big building right up there. But yeah, it's not for everybody.
No.
Now, when you were going through undergrad and working at the Hartford, was exercise a big part of your life?
Yeah. So when I think I started working out like when I was in 8th grade, I picked up a issue of Muscle and Fitness magazine. I still remember, had Brian Urlacher on the cover and, I just really, that's what got me into lifting weights. And, I was kind of doing the original, bodybuilding splits, I was following the, 60 days to abs or whatever, program they had in each one of those magazines. But, throughout college, I was lifting at the UCONN gym. So I just always really enjoyed it. And then on my last year at UCONN, I started doing CrossFit because there had been a local CrossFit that opened up in stores. And then that's kind of when I really got passionate about CrossFit. And then when I graduated in May of 2012, I went back home, joined a box in Glastonbury, Connecticut, where I'm from. And I really knew that I kind of, from early on, I knew that I kind of wanted to be involved with coaching. I remember I probably was like a month or two into CrossFit, and I asked the owner of, hey, can I kind of shadow you while you're doing your on-ramp classes? Because I just want to learn more and I want to be involved that somehow. And thankfully, she was cool enough with letting me shadow those classes. And after graduation, I had time. I ended up taking my CrossFit level 1 that summer. So that was August 2012. And then that following year of January of 2013, I started coaching part-time at the box that I had joined in Glastonbury.
So while you were first starting to shadow, do you remember some of the things that you learned when you were watching some of those intro classes?
A lot of it was, especially with CrossFit, it's just kind of going over the on-ramps that most gyms do, go over the foundational movements. So basically we'll coach, an air squat and, coaching a very basic deadlift, usually with like a PVC pipe and some sort of a press. So it's basic movements like that. And just being able to kind of watch her cue other people and watch other people move. That was kind of just my introduction to coaching. And I really kind of fell in love with it. I just, even from that very beginning.
And that was the first time that you were ever sort of like interacting with clients in a movement setting?
Yeah, absolutely. I think, I guess I had been not really coaching, but I had always taken my roommate with me to the gym and, based off of things that I had read about or found, whatever website, like bodybuilding.com or whatever like that, I would, coach him through some of the lifts that we would do at the UConn gym, but really getting to coach or just observe people move that I didn't know personally, that was definitely my first interaction with that.
It's funny how all of us seem to be like that person in their friend group who is the one encouraging people to go to the gym and start moving, and sort of the helping hand in the intro process for a lot of people. And now we made a career out of it.
Yeah,
so
right?
Definitely how I got started.
Helping your friends out.
Yeah. In the basement of my house, I had everybody over trying to make them lift weights.
Yeah, it's fun to look back on. So what happened after you started helping out at that CrossFit gym, Mike?
So I was only there so I started that gym, that was in January of 2012, and then I graduated that May. So I wasn't there for very long, but then once I had gotten back really and moved back home in Glastonbury, that's when I really inquired about coaching and if I could start shadowing and things like that. And then, the owners at the time, they were like, well, we usually ask people if our coaches have their level 1. So that's why it kind of prompted me to get my level 1 in August of 2012. And then I shadowed for a little bit, and then I started part-time coaching in 2013.
What was that coaching experience like for you, having not really expected it in undergrad?
I really wish that I had like videos of me coaching back then, because I really don't know. I was definitely, even my first couple of years of coaching, I definitely was someone who's like really wanted everything to look absolutely perfect and each rep should look exactly the same. And, my philosophies on that have definitely changed over the years, but I really enjoyed it. It didn't, even when I was doing it part-time, I was doing that along with working at the insurance company. Like, it didn't feel like work to me. Like, I just enjoyed being there. And the fact that I got paid for it was just like, it was funny to me always, because I was like, I get paid to hang out at the gym and like help people. And it just never felt like work to me. So I really enjoyed that experience every time I got to coach. I definitely I think just my personality, like I would always be nervous before I coached because I just wanted to deliver kind of the best experience that I could. But I mean, to me, that was always just because I cared about it so much that I just didn't want to like half-ass it.
What you said sounds very familiar, and I'm sure Paul can relate to this too, just that over time, if we look back at the way that we started as coaches, we kind of might cringe a little bit at some of the things that we were trying to force on our clients, or looking at how our philosophies have changed over time.
Yeah, I think if you can look back at what you were doing and not cringe, then you probably haven't progressed much as a coach.
Yeah, true.
For sure. So how did you end up going from coaching CrossFit to applying to PT school?
So I was coaching CrossFit for maybe about a year and a half full time. And then I ended up getting hurt just playing flag football in like just a summer league. So I hurt my shoulder, and that really impacted my ability to coach class. So I couldn't really demo a lot of the movements in class. I had to do a lot of things just with one arm overhead, especially for like overhead movements. So I'd never been to PT before, went to PT right in town in Glastonbury, and, it was funny because I had to teach my PT a lot of stuff about CrossFit to kind of explain what movements kind of provoked some of my symptoms, but what felt okay. But we had a really good relationship, and he kind of was eager to learn from me about that whole world. And, I was very thankful that, that looking back, that experience could have gone really badly. And who knows where I'd be now if I had gotten a PT that just bashed CrossFit and was like, you should stop doing that. So I was very fortunate with that in that respect, that I got lucky with who my PT was. But it was really going and working with that PT that a lot of my interests kind of blended together. So at the time I had been coaching, Kelly Starrett was kind of the big kind of mobility guru in the CrossFit world. So he, his book, Becoming a Supple Leopard, was kind of like my Bible at that time. And, I was trying to mobilize every joint possible. It took me about like an hour to warm up, before I even touched the barbell for the first time. So that was definitely a big part. But I mean, that's kind of what made me aware of, what a PT, what a physical therapist actually was and what they did, and, the whole rehab world. So looking back, even though I don't do a lot of that stuff or agree with it, it's, kind of what opened my eyes to that world.
I remember those original Kelly Starrett YouTube videos. Follow along every day. Day one.
Yeah.
Day one was sit in a squat for 10 minutes. I still remember
10-minute
that.
squat test.
Yep.
It's a lot of time, man.
Yeah.
It's a lot of time down there. So now, heading into your starting PT school, what would you say some of your expectations were before you got started, so that hopefully we can kind of reference back to them once we talk about what your experience was like after PT school?
Yeah, so I think a big part of what made me want to go to PT school too was, being a coach, I would have these instances where members would come up to me and just say, hey, Mike, due to, I did this in the gym, kind of messed my shoulder up, or I was out doing this and my back's hurting me a little bit today. And we would try to find workarounds for, okay, let's scale this and try to, help you move without exacerbating any of those symptoms. Or, well, at the time it was so that you don't feel any pain at all. And I just didn't like not having the answers for them of like why they were in pain or what we could do to help better address that. For me, it was just, well, I'm not a doctor, so you can go and, try what we're going to do today. But if that doesn't work, I hadn't really have anything for you. And I hated that. So I think that was a big driver into kind of what made me, again, want to go to PT school. And so when I went to PT school, I thought, I was going to have all the answers. It's like, oh, your shoulder hurts. Well, okay, well, it's clearly that muscle right there. And all we have to do is do this, or, you're moving this way. So, all you have to do is change that. Or I thought I was going to get a lot more, quick fixes, and things were going to be a lot more simple than they were. And I think with other experiences that, people that have had some sort of a strength and conditioning background is, you strive to kind of be that manual therapy guru. You think you're just going to be able to mobilize and manipulate things, and kind of just instantly cure people. But, what we've learned, it doesn't really, it's not that easy at all. And pain is a very complex thing. But, I definitely thought that I was going to have those answers that I was looking for going into school.
Yeah, I think that a lot of people have that simplistic mindset of if there is pain, there's this simple fix that you need to correct. Obviously, like it's this one small muscle or it's this movement pattern that if it looks different, you won't be in pain. I know that as a coach, that's something that I was curious about and tried to seek out. Like, oh, I have these clients who are struggling with their squat. So, what is it? There's got to be some assessment or some test I can do to figure out why they aren't squatting well. And it's that simple. And it's really not. So I think that's really awesome insight. Now, when you got to PT school, I know it'd be cool if we could talk about some of the classes that you took and whether or not you felt that they were maybe done really well and prepared you to be a physical therapist in a clinic, or maybe some classes that you were really hoping to get more out of that sort of under-delivered.
Yeah, I mean, I think overall, I definitely enjoyed the whole curriculum that we went through. I think there might be some ways that you could, shift some courses around so that they're of better value when people go through them. But I know, one of my favorite classes and something that kind of broke me out of my shell in terms of, volunteering in class and feeling comfortable raising my hand or just putting myself out there more, was our education and communication for physical therapist class. We just touched a lot about, different ways that people learn and their readiness for change. And that's something that just resonated with me, and, different ways to help people to communicate to people so that they can learn better, take our, whether that's cues better or just kind of explaining kind of the rehab process to them. So that class sticks out in my mind, as like one of my favorites for sure. One of the classes that we had our first summer, it was our evidence-based practice in physical therapy class. And that I really don't remember a lot of what was covered in that class, because that first summer was just like a whirlwind of, we were just getting assaulted with anatomy and, a lot of different courses for the first time, especially for me being out of school for so long. It was entirely a whirlwind. And I remember like our first exam in that class, it was a take-home exam, but I was just so stressed out like that. I almost contemplated like, am I supposed to be here? Like, I don't even know if I can do this, because a lot of it just didn't make sense to me. And I just felt very lost in that class. So that's definitely a class that I feel like would be better served more towards the end of our curriculum, especially in a world of evidence-based medicine. I think that we would be better served as, new grads and future clinicians getting that more towards the end, where we can know how to apply some of the stuff taught in that class into our actual practice, or, just kind of like a second level to that class at the end so we can touch on it again. But in terms of like under delivering, definitely our therapeutic interventions class, I think that's just PT as a whole. I don't think anyone's really satisfied with their TheraX classes. I know a lot of programs are bringing in, more strength and conditioning like electives, which I think is amazing, but more of the fundamental, therapeutic intervention courses are typically on, a lot of passive modalities like ultrasound and e-stim. And, you get some basic, TheraBand exercises and some basic kind of table exercises to bring people through to target certain muscle groups and things like that. But there's definitely a lot that personally I thought could have been covered a lot better in that class. And then I think the last one was probably our motor control class. I definitely didn't understand how important that would be kind of going forward. Now I look back and I wish I paid attention more, and I wish I took more away from that class. But to me, I just, partly is on me, but I just didn't find the connection of, how is this valuable to me? It was kind of one of those classes where I was just like, all right, whatever, like I have to just learn this stuff and do well on the exam, and then I can focus on the things that I want to focus on. But looking back, definitely a lot of the principles in there are coming back now. And I'm like, oh yeah, I remember learning about this or hearing about this in class. So I wish I had paid more attention in that one for sure.
Could you be a little bit more specific on some of the things that were covered in that class that you maybe didn't appreciate, but now you find them apparent in your everyday life?
Yeah, I think so. One of the things too is I had kind of touched on it before with, when I was first a coach, I really wanted every rep to look exactly the same. And, one of the kind of famous images is of a blacksmith from like Nikolai Bernstein, of a blacksmith hitting a hammer over and over again. And it's repetition without repetition. So basically having a strategy to do things that basically the end result can be the same, but your way of getting there doesn't have to be exactly the same every time. So there's different options for that to be created. So it kind of goes into like constraints and things like that, which kind of more on that dynamical systems kind of side of things, which, we definitely talked about in class, but I had absolutely no idea kind of how valuable that would be kind of down the road now when, talking about kind of manipulating constraints for athletes and things like that. So that and the attractor states and detractor states and, how likely, someone is to choose a movement option, again, based on kind of the number of constraints they have available to them or degrees of freedom they have available to them. So definitely a lot of those things that, now, I listen to podcasts and read articles, research articles now, and a lot of that stuff comes up. And, I can remember those lectures like the pictures on the PowerPoint slides and things like that. But at that point, I really didn't find that much value in it back then. It didn't really click for me like it does now.
A lot of the topics that you just brought up, Paul and I have discussed in a little bit more depth on other podcast episodes. And even within those, there's probably more topics that we could spend entire episodes on, right? So you're covering a lot of really big principles and influencers in people's training and rehab that sounds like they were all in that one class. Going back to your therapeutic interventions class that you had mentioned, is that a class that was sort of arming you with all the tools that you would need if somebody presented with certain symptoms or certain whatever pain or an injury somewhere? Like that's the class that's supposed to give you all the tools and how to deal with them?
I don't know if it's more so, I think, covering, what the unfortunate part about most PT school is that they have to cover certain material to prepare you for the board exam. So in that therapeutic intervention class, it was split into 2 semesters. So the first, I believe it was like the first semester that, we were basically learning about, basic, principles of, I guess you could call it programming principles, where we're kind of focused, okay, these are, the number of reps that if we're focusing on power, we're doing, these many reps versus hypertrophy versus endurance, so we're getting some of those basic concepts. And then we were kind of basically learning about certain, these are going to be our hip-based exercises that we're going to use, or our ankle-based exercises that we're going to use for people dealing with, X injury. And then the other part of it was kind of learning how to use ultrasound and the different parameters for that. And, same with E-stim, the different parameters and the settings that you would use if your goal, was to, whether it was, reducing edema or to, stimulate muscle, you would use different parameters, and that's stuff that you have to know for your board exam. So they have to cover it. And, you could tell that our professors weren't thrilled on teaching that either, but they kind of had to.
So they were more just jumping through the hoop with some of that stuff. And
yeah,
once the board exam was over, it wasn't too relevant anymore.
Yeah, no, I definitely haven't gone over my ultrasound parameters since last year. That's for sure.
One of the other classes you mentioned, your education and communication for physical therapists, was that class one of the main drivers in preparing you to deal with a patient face to face once you were on your own? Because you had mentioned that you cover different people's willingness to learn or readiness to learn, and maybe different ways in which they learn, which can be huge, both like from our perspective as a strength coach, trying to communicate something effectively based on the person's learning style, but also in a rehab setting where somebody's willingness to learn, their trust might not be there because they've had experiences with other physical therapists in the past, or they're just defensive because they're currently experiencing a lot of pain. Was that class centered on preparing you for that?
I don't know if anything really prepared us for how complex humans really are in general, but I think, some of the concepts in there definitely are stuff that, you go back into. So, one of the things that we looked at in that class was the Transtheoretical model of change, when people go through, the pre-contemplation stage and contemplation stage and all that stuff. And it's not that anyone ever necessarily fits in, a nice, neat box. I think you can say that for anything in general, but kind of using some of that stuff to, figure out, okay, well, this person in front of me that's dealing with, these symptoms and they have all this stuff going on, where are they in terms of being willing to hear what I have to say, or, figuring out where to pick your battles in terms of they come in with X experiences with previous therapy, or, they have these strongly held beliefs. Kind of, it helps gauge kind of how much you attack on that first day, and kind of if you're more kind of just like dropping seeds of things that you'll touch on later versus, I think, Zach Gabor from Level Up Initiative kind of brings this up all the time that, when he first kind of learned a lot about like pain neuroscience education, that he tried to make it rain RCTs to all of his patients all the time. Some people just, no matter how well-intentioned we are with that stuff, is some of it, they're just like, I don't care about that stuff. Like, I'm just in pain. So some of the concepts that we went over in that class definitely helped, but I don't think, anything really adequately can prepare you for like being, having that experience yourself of really having to sit in front of a person and taking all the complexities of being a human into account.
Yeah, there's a ton of factors at play, and we can relate to that as strength coaches. With some people not caring, I don't care why I'm doing this exercise. I just want to be stronger or leaner or whatever their goal is. And sometimes that can be a little bit frustrating because you want them to care as much as you do, but at the same time you're there to serve them, and so you need to help them arrive at their destination however they need. When it came to sort of leaving your school setting and your clinics and heading into a professional setting where you were by yourself, what was that transition like for you, or how have you grown since you started having your own patients?
So I think so in our curriculum, our last year was basically all full-time clinicals. So depending on the environment that I was in, a little bit different on, especially, me, I'm tend to be a little bit more reserved in general and a little bit more cautious, especially when I'm not completely confident in what I'm doing. So in some of my acute care rotations early on, I was kind of a little bit more hesitant to approach things in a certain way. My neurological rehabilitation setting that I did, same boat. But then I was more comfortable kind of having my own patients in the kind of orthopedic realm, just because that to me was more my environment. Like it felt just like kind of coaching in the gym a little bit, where people tend to be a little bit less medically complex in that environment. So I think that helps a lot too. But you also have more time with patients too. Like I know one of the things I hated about my acute care rotation was how little time I had with people. And it got better when I went into a skilled nursing facility. I had more treatment time, but being like in an outpatient setting and having that time to actually like listen to someone's story and then, just connect on a human level, even, when you're just in between sets of exercises, that was really where I felt most comfortable kind of from the get-go.
How much time did you have with people when you weren't really happy with it? Was it really short and you had a lot to do during that time?
I think it depended. So when I was in my acute care rotation, there was no real schedule. It's basically like you get, if you can catch a person when they're in their room and they don't have to go get, some diagnostic imaging done, or they're not eating, or, they're not asleep. Cause I always felt bad trying to wake people up, to do therapy, because sleep is also really important. And, it's really hard to get a good sleep when you're in the hospital. So I always felt bad kind of waking people up, do their therapy. So you might start a session, but then, some other, healthcare provider might come in. And if the doctor comes in, then especially in a hospital setting, I always felt like, when the doctor came in, I was like, all right, well, I'm done, because they kind of take priority there. So I just never felt, it was just never consistent. But, at times, it was maybe like 20, 30 minutes that I got. And some of that was just spent on preparing to do what we were going to do. So like setting up the room and making sure that if we had to use a wheelchair, that was in the right spot, or, if there were chair alarms, that we had to make sure those were taken care of. My first week or two, I was setting off bed alarms and chair alarms all over the place. So a lot of it wasn't spent on doing actual like treatment. For me, it was kind of a lot of setup, and, it was very unpredictable in that environment. So it just never was super comfortable for me.
And then at your skilled nursing facility, you managed to find a little bit more predictability with that?
Yeah, thankfully, there was more adherence to kind of schedules when I was in the skilled nursing facility that I was in. And I had, based on how the billing was done at that time, I had certain number of minutes with each patient. So I may have 45 minutes scheduled with the patient. I may have 60 minutes scheduled with the patient based on if they were seen over the weekend or if they had declined therapy the previous day. We had to make up for those minutes on the back end. So I just sometimes ended up getting, I think I had the most time. I had like 75 minutes with the patient. And sometimes that was good and bad. I had more time, but sometimes depending on, where they were from a functional standpoint, we weren't really able to, I didn't need that much time. So it had its positives and negatives to it.
And these are all clinicals that you had to do through UCONN to fulfill your requirements to graduate, right?
Yep.
So was that clinical process at UCONN, did you have access to a lot of facilities that you were really interested in maybe learning from? Or was the selection kind of limited? Did you get any say in where you went? Or did you just have to make a list and they put you where they could?
So we had like a lottery system just so everyone kind of got a fair chance at going to either somewhere that they wanted to go, or if some people wanted to travel, people wanted to stay close. I knew based on how we did our rotations that we had to do a 10-week rotation, an 11-week rotation, and a 12-week rotation. And I knew right from the get-go that I wanted my 12-week rotation to be my outpatient ortho experience because I wanted the most time there. So for my first pick, I wanted to kind of get acute care out of the way. So I did that because it was just the shortest. And, we usually had a list of places that we could go to. You could also, if you wanted to make a special request, that wasn't always guaranteed. So you could make that request if you wanted to. But again, if that didn't fall through, then you had to, pick from the kind of set list that we had. So, for my first 2 rotations, I, just picked a place that was on those lists that they had. I stayed in Connecticut for both because as attractive as traveling was to me at the time, it's, I wanted to, save money and I didn't want to have to worry about having to pay for finding a place to stay. So I stayed in Connecticut so I could just stay at home for that. And then my last rotation, I made a special request for. I went to a place in Milford who had a lot of CrossFit athletes just because they were affiliated with a CrossFit gym in Milford. So me having that CrossFit background, I knew that, I was like, I definitely want to get to this place. So I special requested that and thankfully got it for my last rotation, which was my longest.
So what was the environment like there that intrigued you so much? Obviously working with the CrossFit athletes, but was it mostly hands-on with a younger, more active population? Or how did it differ from like the first 2?
Yeah, I think, definitely more active population. I think the population that we saw, even if they weren't CrossFit athletes, they tended to be either they, went to Orange Theory or they were, sometimes we had high school athletes there too. So it was definitely a more active population and definitely less medically complex than, people that I would see in the skilled nursing facility or in the acute care hospital. But definitely, I think compared to other settings that you may go to, especially in an outpatient, it very varies depending on where you are in the country too, I'm sure. But I would say we had a very active population. So it was a lot of fun for me. I really enjoyed that last one.
Yeah, it sounds like from the 3 that you had just mentioned that you got a pretty wide variety of patients in front of you from all walks of life and all different times of their lives. And we had kind of hinted at this earlier, the biopsychosocial model in relation to rehab. Is that something that was talked about while you were in class? Is it something that you found through continuing education resources on your own? And is it something that you actively use in your day-to-day life?
Yeah, again, very fortunate in our program. We definitely talked about the biopsychosocial model. So we were exposed to that very early on in our curriculum. And, we talked a lot about, patient first language. So it still actually bothers me to this day when, people are saying, oh, I have my knee patient or I have my, my shoulder. For me, it was always like, that's something that really resonated with me. Or like, I have a patient who's dealing with a shoulder injury, or I have a patient who just had a knee replacement. So that's something that I always kind of in my head, even if I don't verbalize it, when people say that, I kind of say it in my head, because that was definitely something that was brought to our attention very early on. And, aside from the biopsychosocial model, we were exposed to varying different pain models as well from one of our professors. So she really exposed me to a lot of that stuff that, from what I've heard from other clinicians and new grads is not a lot of programs are as fortunate to be exposed to, one, the biopsychosocial model, and 2, kind of different models of pain and kind of the, definition used by the, International Association for the Study of Pain. So I was very fortunate from kind of what we got exposed to.
Paul and I see this a lot, what you had just mentioned, where maybe a clinician refers to somebody by their pain or their pathology. We see a lot of people who will come in and they feel like they are a bad back or they are a bad knee. And so that's something that we very frequently will deal with, even though we're not physical therapists, and sort of have to reframe the way that they're looking at themselves or their capabilities.
Yeah, you actually kind of hit on 2 of our big kind of core values, and in 2 of the classes that you talked about, the education and communication, and then the evidence-based practice. So I'm actually throw it back a little bit because that's the one class we didn't really get to dive into. And on Instagram, we hear that term evidence-based thrown around a lot, but What does that actually mean, and what did you kind of learn in that class?
So I know a lot of the stuff that we went over in that class, we were kind of learning about what p-values were and kind of what, made, data kind of statistically significant, and, different ways to analyze data, which, a lot of that, I'm definitely not an expert on any of that stuff. So there's a lot of ways on how you can analyze data. And we covered a lot of that stuff. And again, a lot of that first semester was really over my head. And I wish we had touched on that a little bit later in the curriculum, even if it was a refresher, because there's a lot of stuff that I've had to go back on and kind of find myself. And I just recently just did a course by Eric Mera on, what is science. And he talked about, p hacking and things like that. And there's things that I just had never even heard of before. And we may have touched upon it in that class. I don't want to do that class just justice because it may have been covered. It just may have been, I may have just been so lost in everything that was going on my first semester of PT school that it just completely flew over my head. But, especially with evidence-based practice and, you have, your clinical expertise, and then you have the evidence and then patient preferences as well. And a lot of times it's made to believe that those things should be equally weighted. But again, I think Eric Mera might want to have been the first people that kind of brought about the funnel approach to that on, yes, we take patient preferences into account for sure. And then we take our own experience as clinicians into account. But the top, at the top of that funnel is really where the evidence should be. And, there's varying, people are, argue about this all the time on social media and things about that of, whether if we're just kind of always taking, we need a research study for everything. And, we're not taking into account what the patient wants and everything like that. And, there's a lot of, again, debate on that. But in my mind, I'm more kind of a fan of that funnel approach, because I think at the end of the day, especially with a lot of the new research that has come out, is we really want to kind of start at, okay, well, what do we have evidence to justify what we're doing? Is it, something that's one, kind of safe for the patient that we're working with? Is it effective for what we're trying to treat, or is it not effective at all for what we're trying to treat? Because, sometimes what the evidence shows you is what really you shouldn't do. And then, you kind of take that into account with your own things that you've seen yourself as a clinician, and either patient presentations or things that have worked well for certain patients in the past. And you take that into account along with their, patient preferences, which, if someone comes in, they've had this success in therapy in the past doing maybe some sort of intervention that doesn't have the greatest data behind it, we can't just, as much as we want to kind of just shit on it, we can't just attack it right off the bat and just be like, oh, that's complete crap. We don't want to do that at all. We have to take that into account. And, maybe we say, well, would you be open to hearing some of the new research behind that? Or you maybe take it as, okay, well, maybe that's something that we can explore if that's something that you've had great success with in the past, but let's make sure that we're doing some of the things that we've have really good evidence for that are effective, whether that's, again, modifying their activity or addressing some of their other, lifestyle factors, or, getting them to just move in general. Let's make sure that we're covering our base there. And then, we want to make sure that we're doing kind of the stuff that the data is showing is really effective. And then on the side, we can definitely, again, if that's really important for you, we can incorporate that. That's something that you feel strongly about. So, I would personally take that funnel approach versus kind of considering it as like a stool, which a lot of people kind of make a reference to as well.
When you say data, you mean data from Instagram, right?
Yeah, of course. The checks and the X's. So basically, the more green checks the post has, the more data is behind it.
And if it's from somebody with a blue tick in their profile.
Oh yeah. If they got that verified status, then for sure.
So with the evidence-based practice and everything that you learned in that course, and again, all of the continuing ed resources that you're using, when you brought all of these skills out into your clinic, was there anything that caught you off guard that maybe you weren't ready for after PT school?
Yeah, I think, like I said, kind of dealing with the complexity of humans was something that still is going to be developed, for the rest of my career. But, it's easy when you're a student, and especially I was very thankful that I found Clinical Athlete in the Level Up Initiative while I was in PT school. So when I would hear CI or other clinicians kind of say certain things that I wouldn't necessarily agree with, in the back of my head, I was like, oh, why would they say that? Things like that. But then, when you're the actual clinician and you're dealing with that person in front of you, it's a lot harder to actually manage that situation versus being the person that's not in the hot seat. So definitely, again, having some of those difficult conversations with people, especially if they've dealt with, if they haven't had the best experiences with PT in the past, or, they come in with these preconceived notions on, what physical therapy is and, or what it should be, or what they found on Google, or what their family member told them they need to do. So being able to address a lot of those things is a lot harder than I anticipated them to be. And kind of knowing that people aren't just going to come in with one thing was also eye-opening, especially I think in the clinic that I deal with people that are, I guess, a little bit of an older population, but they tend to be, what I would consider maybe a little bit more medically complex, where they have other comorbidities along with, they might come in with some shoulder pain, but they also may have a history of heart disease or hypertension, or, history of, some joint replacements. So even though they come in, on the referral, it's just for left shoulder pain, you uncover that, they have this history of, there's a lot of other things going on. So they don't fit into that nice, neat box that you got on that shoulder pain lecture back in physical therapy school.
When you guys were role playing in school, you guys were nice to each other and only gave each other, one pain symptom or, one comorbidity.
Yeah, it was, we either were a little bit too nice to each other and we didn't kind of want to give each other too hard of a time, or I always struggled with role playing just because maybe it was just no one took it seriously just in general. But it's not that I didn't think any of that stuff was important. It was just, I just could never put myself in the same situation as I could. Like if you put me in front of another person that I didn't know or patient, I felt more comfortable doing that than I felt role playing with one of my classmates.
Yeah, role playing can get pretty awkward.
Yeah, you can't make up a complex human problem and then present it to somebody. You're like, in PT school, you're not an actor. Because people that come to you have complex human issues that are, so a lot of it extends beyond just that pain that they're coming to you for. And you have to be able to kind of look at the whole person in front of you and treat the whole person in front of you, and not just be kind of focusing in on one part when somebody comes to you with a lot of other issues. And, that sometimes that's not the way things are presented in the textbooks. Like you learn things in a very granular manner. So how did you go about trying to bridge that gap to being able to apply the things you learn, but in a more useful manner?
Yes, I think a lot that's changed for me has been, when I first graduated, a lot of it, we get a lot of the objective on, measuring range of motion and doing these joint mobility assessments and special tests. And so there's a lot of emphasis on, the objective portion of the exam, but really a lot of what I've found more value in. And, it's not that we didn't give it value in school, is that, they had to teach us all this stuff to go out on our clinicals and make sure that we were safe to practice and things like that. But, I've really put a lot more focus on the subjective portion of my exam. So patient history and kind of understanding what they may think is going on, or, what other, yes, you're coming in with this discomfort or this pain, but what else is going on in your life, and how physically active are you in general, or what do you want to be able to do? What's your motivation for wanting to feel better? So that people don't come to us because they're in pain. They come to us because that pain has taken something away from them that they want to have back or be able to do again. So I think being able to uncover that stuff, by listening to them, to me, is of more value than looking at certain joint ranges of motion and doing these special tests that, we find out aren't very special anyway. So I think that's been something that I've tried to give a lot of more, importance to when I go through, initial evaluation.
Yeah, I think sometimes people have this like idea that PT school doesn't prepare you for the job, but in reality, they have a very short time to teach you a very large amount of information. And I think something that's come up multiple times is that it's complex and the person in front of you is complex. And really, there's no way to learn everything you need to learn in just the time you're at PT school and to learn everything you need to do to pass the boards. So it sounds like you did a lot of things kind of on your own time to help bridge that gap between the things you were learning and being able to apply it. So can you talk a little bit about some of those things that you started in school? You mentioned a couple of them already with Level Up and Clinical Athlete. I think there was probably a couple more that you were involved with.
Yeah, so I think the big two are really the Level Up initiative, which definitely has been, a huge influence on who I am today as a clinician and, who I want to be down the road, and kind of basically understanding that the issues that we've had with addressing things from purely a biomedical perspective and the importance of considering more of biopsychosocial perspective and how, one, it's easy to talk about those things, but then it's hard to implement that. So I think that they've provided a lot of resources. They have their free 4-month mentorship that, it's not just for physical therapists. It's really for, any healthcare practitioner or, strength coach. I think there's some massage therapists that are also in there as well. So it's really just a different way to kind of approach kind of some of the information that we may have learned in school, getting those various degrees and kind of putting another spin on it and being able to think critically about that information that we've learned and taking into account kind of some of the more emerging research, because, the biomedical model has worked for certain things, but then, we have a chronic pain, problem in the United States. And, if something was as simple as if it was purely a biomedical issue, then we probably wouldn't be seeing the issues with chronic pain that we're seeing in this country or in the world. So there's got to be something more to that. And it kind of, like I said, I was fortunate to get it in my schooling, but in other programs, I'm not exactly sure how much exposure they're getting to that. So I think not only from the information that they cover in some of those modules, but then also just being able to network with other professionals that think that way. Because like I said, you can get a presentation on it, you can get all these research articles about it, but then, how do you implement that? So for me, I've had the fortune of being able to shadow people that I've met either through Level Up or through Clinical Athlete and kind of saying, okay, well, how are they taking this information and then using it? So for me, that's the information that they presented in their modules, but also that kind of the resource of a network of clinicians that they have. Part of that have been truly influential in kind of who I'm continuing to become as a person and a clinician.
Yeah, you actually mentioned two things there that I wanted to kind of dive into a little bit, was that there's always emerging research. So no matter what you're learning in school, there's always more to be learned because there's always new research coming out almost every day. This is a super young field. They haven't been studying pain and they haven't been studying strength and conditioning for that long. So there's always new information coming out. So how do you kind of keep on top of that?
Yeah, it can be overwhelming, especially when you're in the clinic, 8 hours a day, you have just your other life going on yourself. It's tough to always stay on top of some of that stuff. But, things that have been very helpful to me is there's a few different companies that put out research reviews. So Physio Network is one of those. They have a subscription service where every month they put out an issue of, I think 10 or 12 summaries from different authors, so that you can kind of read the summary on that, and then they kind of give you a little blurb on, what does this information mean? And for me personally, I think that breakdown in a summary is nice, but then if there's something that I want to dive deeper into, I go and read that article that they talk about and read it for myself and see if I can kind of come up with some of the same findings myself, or if there's things I disagree with or agree with that person that wrote that summary. Barbell Medicine does the same thing. They have their monthly research review as well. So those are the two that I use myself. And then I find a lot of value from podcasts, more so from really kind of the resources that people usually talk about in podcasts. So people will sometimes mention certain papers, and then I'll, make a note to kind of jot down that paper. Or, social media can be terrible and great at the same time. You have certain people that put out a bunch of nonsense, unfortunately, but then you also have, if you go through my photo album on my phone, a lot of it's just screenshots of like research articles that certain people share. And I get a quick picture of that, and I'm like, okay, I got to go look up that article at some point. So I try to use that as well to kind of just give me some more resources. So those are kind of the few things, podcasts, research reviews, and then using social media for, again, getting some more resources. That's how I try to stay on top of the research as much as I can. But it's definitely challenging. I get it. But, I think as part of being a professional, that's a part of our job. And again, if you're not staying on top of it, especially in a field that's deals with science and it's continuously evolving, that you need to be doing that in order to stay up on your game, for yourself, but also for your patients or your clients. So I think that that's hugely important. And, I think the unfortunate thing is that some people graduate or they get a certain certification and they think that, that's it. Like they know all they need to know and then they're good. But really it's just, that's your ticket to sit at the table. That's your entry point to whatever. This is the event, right? This is the show. But, that's just the beginning. So you need to continuously get better in order to really survive in this world. Or I guess you could survive without doing it, but then you're not really good at what you do.
Yeah. That hit on another one of our core values, always be learning. And something that you brought up in your podcast was always be a white belt, which I liked a lot. So you're always trying to get better at whatever task you are doing. And, those research reviews are super helpful. Mass does one with Eric Helms and Greg Knuckles. That's a little more strength and conditioning based that we use a lot in Barbell Medicine as well.
Yeah, two things that you said that I think are really important is if you're not going to be good at what you do because you're not continuing to keep up with the research, people are trusting you with their health, their only body, and a lot of times their ability to participate in activities that are near and dear to who they are as a person. And so if you choose to get into either the rehab field or even the strength field, I personally feel that you owe it to your clients to always be on top of what's coming out, because your job is to serve them. That's the whole reason that they're paying you. And if you're not giving them the most up-to-date information or operating on best practices, then you really shouldn't be the one taking their money.
Yeah, absolutely. And it's, one of the things I just wanted to say, and I'm sure you guys have maybe shared these same sentiments, where I'm not comfortable sending one of my family members or someone that I know to just anyone. And I hate saying that, but as much as I want to be a pioneer for someone that advocates, for physical therapy, I'm not at a place where I'm comfortable with you just going to any physical therapist, because I don't know what they're going to say. And I think maybe you guys feel, I don't know if you guys feel the same way about, other strength coaches or other personal trainers. I'm careful who I refer people to, and I kind of do my homework for them before I'm comfortable with them going to either physical therapy or to work with a personal trainer or a strength coach, because I don't want them to be fed something that's, going to be, damaging to them or make them feel worse about themselves than they just want to either get moving or they want to start feeling better because they're dealing with some sort of pain. So I don't know. Have you guys felt that before?
I think you can say that about any profession. Is, there's people that are good and there's people that are not so great. And one of the things that we're really striving to do is bring some light to some of those things that are happening that aren't, best practices, and what we can do to continue to strive to be better. And I think you hit on a lot of those things with communication and evidence-based practice and continuing education. And the last thing that I wanted to talk about that you mentioned in continuing education is something that I've noticed that you do a lot of, and that is shadowing. You kind of already brought it up 2 or 3 times now. I think it's very valuable to be able to seek out people that are good at what they do and shadow, and you've kind of mastered that task. So what made you want to do that, and how do you kind of go about being successful and shadowing so many people that are so successful?
Yeah, I think part of it is, I think, due to my learning style too. I'm kind of very visual in a way where I like to I like to see how something is done, or I like to be able to first watch someone do something so that I can kind of understand, at least have like a general framework of whatever that thing is. So like for me in physical therapy school, like I liked watching my professors kind of do little mock exams with, one of my classmates, or, whether it was learning, a certain technique. I just like to be able to watch that a few times before, I'm not the kind of person that was always like willing to just jump in and just try and kind of, some people like really like to jump in and just learn by doing. I've always been a little bit more reserved in that I would rather kind of watch it a little bit more and take the time to observe it. And then once I'm comfortable and I feel like I have a decent grasp on it, then I'm kind of comfortable doing it myself. And, I'm not saying that that's either good or bad, but for me, that's just kind of how I always learn best. So whether I was a coach or I was, now a clinician, I still find a lot of value in being able to watch other people either, coach movements or, just interact with people and kind of do their subjective portion of an exam, because so many times already, just from either, listening to my coworkers or watching you guys do what you guys do is, the way you guys say things or demonstrate something, it's a way that the end goal may have been similar and I may have wanted to do that same thing or deliver that same message, but the way that someone either says something or shows something is just a way that I never could have thought of doing myself. So I find a lot of value in that. And it's something that I will continue to do forever, because that's just how I learn best. And I really find a lot of value from doing that. As far as, being able to, thankful I'm surrounded by a lot of people that I consider to be at the top of their game. And, it's a big reason that I kind of took the job that I did, was because, some of the clinicians that work where I do are people that I kind of looked up to in the field. And then, a huge part of why I, train with you guys is at the time when Revolutions just opened up, I kind of did my own thing for a little while, but watching you guys kind of interact with, your clients and the Resilient crew, it's, I felt that our messages kind of aligned and we had the same philosophies on things. And that's what really, it's a testament to you guys, because I was able to put my trust in you guys and to take my training into your hands. So, thankfully, again, part of it is, I think, luck in being surrounded with, who I'm surrounded with. And then the other part is that, that's just how I like to learn. So I think that's just been valuable for me.
Thank you. And I think the two big things you kind of were saying that said there that you were saying but didn't actually say were, one is you've continued to shadow people even now that you have a job as a PT, not just during school, and that you've shadowed people, outside of your field too, strength coaches and PTs. And then the other part is that you can't be afraid to ask to shadow people, because most people will say yes. Is if you want to learn some more from somebody, just reach out and see what they'll do, because you'll probably surprise yourself.
Yeah, at times I'm more of a reserved person in general, but like I always try to remind myself that what's the worst that happens? They say no. It's like, okay, well, I'm in the same place where I was, but on the other hand, they say yes, and then awesome, I can shadow and learn. So definitely, depending on people's personalities, I think that's a little easier said than done. Just kind of put yourself out there. But if there's only one way to get what you want, and you have to ask that question, because otherwise you don't have it either way. So kind of being willing to put yourself out there and just ask, hey, do you mind if I just come in and watch you for an hour or two? And like you said, most people don't have a problem with that, especially if they've done that in the past. Like a lot of people want to help other people learn and are more than, anyone that I don't think I've asked anyone that's just said no to me. So knock on wood that I don't run into that situation. But, I think a lot of people want to help others. So you just got to ask.
I think you've clearly demonstrated that your commitment to always learning is there and you aren't just learning from one source. There are several different channels where you get your information and you're always thinking critically of it. So with that being said, do you feel that PT school in general is in a good spot right now? Or do you think that there are some significant changes that should be made?
I think it's moving in the right direction. Slowly, but I think it's moving there. Again, I think a big part of it is always on the 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 body that kind of controls, the people that write the board exam kind of dictate what's covered in the curriculum to a large extent. But then I think, there are professors now these days that are, more in tune with the research. And even if they have to teach these certain things, they teach them, but they also will give you more up-to-date information. And I've had professors that were like, you need to know this, but this is kind of some of the more recent stuff. So I think that that's getting a little bit better. Again, I can't speak for, every program out there, but I know, at least the programs that I've been, familiar with around the state of Connecticut and, Massachusetts and things like that. It's, I've heard that it's slowly moving in that direction. There are now strength and conditioning electives being brought into curriculums. So there's a lot of them are still electives, but again, it's a step in the right direction. So I think if you remember that, I think there's a lot of ways that we can bash on PT school, but if you remember that the end goal of a PT school is they need you to pass your board exam, and they create you to become a generalist as a therapist, because not everyone wants to be in an outpatient orthopedic setting. Some people really want to work in the acute care setting. Some people want to do neurological rehab. So again, there's like Paul was saying, there's such a large amount of knowledge that they have to cover in 3 years that it's even really 2, because the last year I was really all out on clinical. So we have 2 years of the didactic portion of our curriculum. That's such a short amount of time to cover everything there is. So I think they're doing the best that they can, and it's, again, moving in the right direction.
So moving past, I guess, PT school and into your field as a whole, I know you're new to it, you're young, but has there been a significant change in the way that PT or the field in general has evolved? Is it moving in a certain direction, or is it sort of strengthening up some weak points in it?
Yeah, I think I want to say that it's moving in the right direction. And again, that may just be due to the people that I follow personally on my, social media platforms and what I see. So as much as I want to believe that it's heading in the right direction, overall, I'm not sure how much it is. But again, it's got to start somewhere, right? And even if it's starting with a small number of people, that's the only way that we're really going to get things done. If we start to if it starts with one person, it starts with one person, and that one person teaches someone else, and then they teach someone else. So that's the way that things spread. So I think even if it is a small portion of the profession that is kind of thinking along those lines these days, that we can still create a difference that way, and we can still kind of move things along. It's not going to be overnight, but I think I said before, I think we're heading in the right direction.
Yeah, I've seen a lot of really cool information out there from physical therapists, and I see them consistently interacting with students that are currently going through a program, or these students have access to maybe very skilled clinicians, and there's just a lot of almost reinvesting back into their roots. So if somebody came from a program, they're going back and helping the current students figure things out, figure out the lay of the land, or providing, again, learning opportunities for them. So that is really cool to see. And then beyond that, there's been, from my perspective, again, it could just be the people that I surround myself with, but more of an integration of the strength and conditioning world to the rehab world. And so that's been awesome to see, because it's also broadened my horizons and brought me new people to learn from, new material to absorb. And I mean, I even met you, Mike, at a workshop from somebody who we both happen to follow. And again, this takes me back to what you had said earlier about how there can be a positive side to social media if you know who you're following and you're finding the right people to learn from. So that's actually how we originally connected.
Mm-hmm. Yeah, for sure.
I know you just put out your own podcast, so if you want to plug yourself, go ahead. How can people get in contact with you if they have any questions or want to learn more about you?
Yeah, so I just started my own podcast, so I'll be kind of slowly putting out some more episodes, and hopefully I'll have you guys either on together or individually on there at some point. But the podcast is called Mic Check. It's starting to get on more platforms because I literally just launched it this past weekend. So it's on Spotify and Anchor right now, Google Podcasts. So I'm still waiting on Apple Podcasts. They're taking forever, but they should be there hopefully by the end of the week. So definitely feel free to give that a listen. I probably am most active on Instagram. That's at Velasquez 1218. Hopefully my name will be in the podcast episode because otherwise people probably won't know how to spell that. But definitely feel free to reach out to me through there or my contact information. You guys can put my Gaylord email. It's a PT place that I work for. So that's mvelasquez@gaylord.org. But again, you have to know how to spell my last name to be able to do that.
All right, Michael. Thanks for your time today, man. It was really cool getting to talk to you about your experience both in exercise and PT school. One of the conditions of coming on the podcast is you have to leave a review for us. So we'd appreciate that. As well as anybody listening, we need reviews. So,
oh, yeah, absolutely. Just like I tell my Uber drivers.
Awesome. Well, thanks everybody for listening again. Resilient Training Lab podcast, www.resilienttraininglab.com. Thanks everybody. Have a good one.
Thank you all.